Hi, everybody. Thanks, Joe, for the intro. This is Beth, Shirley, and we're going to talk about nitric oxide and its role in circulation, microcirculation, and peripheral neuropathy. So there's my bio. Y'all can read that later. So why is nitric oxide essential? It regulates all cardiovascular function and homeostasis. Nitric oxide governs circulation and microcirculation. So the microcirculation is where all the exchange takes place. This is very critical to health. Red blood cells require adequate nitric oxide to deliver oxygen to the cells. Supports neurotransmitter function. Regulates gastrointestinal function, including gastroparesis, a healthy mucous membrane lining, and the health of microbiomes everywhere, from the intestinal tract, the oral microbiome, skin, urinary tract, everywhere. Helps activate the GLUT4 receptor in order to translocate and bring glucose into the cell. Controls the efficiency of the mitochondria in the generation of energy and the generation of hormones. This is precisely where cholesterol gets metabolized into pregnenolone. It's essential for sexual function in both men and women. It's required for stem cell mobilization and differentiation. Stem cells require nitric oxide in order to go where they need to go, do what they need to do to heal. Regulates the immune system function, regulates the inflammatory response, and scavenges free radical. It modifies platelet activation and aggregation. This is the thrombus formation. Supports telomerase activity, which has everything to do with longevity. So we make nitric oxide through two different pathways. The first one, arginine, is oxidized through the NOS, nitric oxide synthase enzyme, into nitric oxide and citrulline. And the nitrate pathway. We consume the nitrate, they get absorbed, they circulate around, get concentrated in the salivary gland. The salivary glands release the nitrate. We've got good anaerobic bacteria on the dorsal aspect of our tongue, which will reduce that nitrate to nitrite. The nitrite is swallowed, and some of the nitrite in the acidic environment of the stomach gets reduced to nitric oxide. However, most of the nitrite is absorbed, circulates around, and acts like a nitric oxide donor. So in our tissues, we have different enzymes that have nitrite reductase activity that can reduce that nitrite to nitric oxide on an as-needed basis. For example, the myoglobin in the muscles can make the nitric oxide as needed. The electron transport chain can make nitric oxide as needed. So as we age, our ability to make nitric oxide decreases. Us women can hold on to that ability a little better than men until we reach menopause, and then it kind of evens out. So our ability to make nitric oxide through NOS, endothelial nitric oxide synthase, decreases to about 50% by the time we're 40, and it's decreased to about 15% by the time we're 60. That is why it is so imperative to support that nitrate to nitrite to nitric oxide pathway, because cardiovascular disease is still the #1 killer. So the factors affecting nitric oxide formation: aging, we talked about that, the diet, the standard American diet, inflammatory diet, devoid of the nutrients and the cofactors needed, and devoid of the nitrate-rich veggies, arugula, spinach, celery, beets, lettuce. The lack of exercise, medications such as antibiotics, antidepressants, birth control pills, NSAIDs, PPIs inhibit the production of nitric oxide through both pathways. EMFs increase oxidative stress, and we're all swimming in this sea of EMF exposure. By increasing oxidative stress, this uncouples the NOS enzyme. And we'll talk about that in just a moment. Pollution increases oxidative stress. Glyphosate uncouples this NOS enzyme. Genetics, and not just your NOS SNPs, NOS SNPs. Anything that increases oxidative stress. You've got your SOD SNPs, your catalase SNPs, your HFE SNPs, anything that interferes with the production of BH4, your QDPR, your DHFR. If you have any MTHFR SNPs, you are by definition nitric oxide deficient. And stress, the big one, uncouples the NOS enzyme. When NOS is coupled, it is a dimer and is coupled with BH4. And the electron is handed down through your NADPH, FAD, FMN, through the heme moiety of the dimer to arginine to make nitric oxide. When NOS is uncoupled, that electron is handed down to oxygen and it makes superoxide. So when NOS is uncoupled, the NOS enzyme becomes a superoxide generator, not a nitric oxide generator. So all of those factors I was talking about a little bit earlier uncouple that NOS enzyme. Uncoupled NOS produces superoxide, not nitric oxide, increasing oxidative stress, which increases the NOS uncoupling even more. So we talked about how this NOS uncoupling increases as we age with environmental toxicity, with meds, and chronic disease states. And arginine supplementation is just not effective to increase nitric oxide stores in the aging population and those with chronic diseases. So nitrates bypass that NOS enzyme, and they're an effective way to restore nitric oxide bioavailability. So supporting that nitrate to nitrite to nitric oxide pathway helps to recouple NOS and reduce reactive oxygen species and oxidative stress. So the nitrate inhibits NADPH oxidase, the NOx enzyme. This NOx enzyme gets upregulated through all sorts of environmental toxicity, inflammation, infections, mold. And NOx's only purpose is to make superoxide. Well, when NADPH oxidase is upregulated, this kind of steals that NADPH that is needed for glutathione reduction, steroid synthesis, fatty acid synthesis. And by supporting this pathway, you are inhibiting this NOx, decreasing superoxide production. The nitrates also help upregulate that BH4 production. And BH4 recouples the NOS. The nitrate to nitrite to nitric oxide pathway increases the activity of your SOD and your catalase. This will decrease oxidative stress and prevents NOS uncoupling. Supporting that pathway increases nitric oxide bioavailability by inducing heme oxygenase and decreasing serum xanthine oxidase. Also scavenges free radicals and decreases oxidative stress. So nitric oxide governs circulation and microcirculation. Has everything to do with vasodilation and blood flow. Anti-atherogenic, it inhibits vascular plaque. Antithrombotic, inhibits activation and aggregation of the platelets. Controls endothelial permeability. Inhibits adhesion molecule activation and expression. Your VCAM, your ICAMs. It inhibits leukocyte adherence and migration. This is the plaques. Inhibits arterial stiffness and inhibits inflammation. With impaired circulation and microcirculation, healing cannot and will not happen. So I want to talk a little bit about the nitric oxide and the RAAS system, the renin-angiotensin-aldosterone system. So this imbalance of nitric oxide and the RAAS cycle, you get pathogenic vasoconstriction. When nitric oxide production is inhibited, think that uncoupled NOS, your NADPH steal by upregulated NOx, you are stimulating this ACE, you're increasing Ang2, you're increasing superoxide, increasing interleukin-6. These are all inflammatory. So Ang2 decreases nitric oxide bioavailability by promoting oxidative stress. That's that interleukin-6. But nitric oxide antagonizes the effect of Ang2 on the vascular tone, cell growth, and renal sodium excretions. Nitric oxide downregulates the synthesis of ACE and Ang2 type 1 receptors. I put this in there because this is where the ACE and the ARBs work. By optimizing nitric oxide, you are actually performing the same function as the ACE or the ARBs. You're addressing the same receptors and molecules. So with high blood pressure, this is a risk factor for cognitive decline and dementia. And 50% of the adults have high blood pressure. And the high blood pressure occurs decades prior to the onset of dementia. And this hypertension affects the blood flow in the periphery as well as the brain. So even though our brain only has about 2% of our body mass, it consumes 25% of our body's requirement for oxygen. So that blood flow to the brain is critical. When that's impaired, you have increased risk of neurodegenerative disease. So nitric oxide in the hypothalamus and the cerebral cortex, this is where the learning process and the memory formation happens. Nitric oxide is a neuromodulator. It modulates BDNF, which has everything to do with synaptic plasticity and neurogenesis, memory formation. Nitric oxide supports mitochondrial function and actually biogenesis of mitochondria to increase the production of your ATP, your energy molecule. So studies have showed that those ARBs and ACE inhibitors benefit long-term cognition. So they're working on that RAAS system, but by optimizing the nitric oxide, you are essentially working on that RAAS system, benefiting long-term cognition. So optimizing nitric oxide during inflammatory states, neuroinflammation, like that we're seeing now with long haul or post-shot TBIs, you'd be blocking the cytokine storm. We are down-regulating inflammatory cytokines such as NLRP3, interleukin-1b, interleukin-6, interleukin-18. We decrease mast cell degranulation and histamine release. We all know what it feels like when that histamine is high. We don't feel good. We don't think good. We're decreasing myeloperoxidase activity, which decrease reactive oxygen species and oxidative stress. We're stopping hypoxia reperfusion injuries. We're limiting lipid peroxidation and the resultant cell damage. We're helping rebalance the T cells, and we're restoring oxygen delivery and removal of waste. So blockade of neuroinflammation restores adult neurogenesis. By supporting the nitrate to nitrite to nitric oxide pathway, we're increasing nitric oxide directly. We're helping to recouple that NOS enzyme, decreasing oxidative stress. There's an inflammatory component and oxidative stress component to every single thing that becomes chronic, that goes wrong. So this pathway, the nitrate to nitrite to nitric oxide pathway, is not sensitive to oxygen like NOS is. In fact, hypoxia stimulates this pathway. It's protective and reestablishes endothelial function, inhibits thrombosis, has antimicrobial activity, anti-inflammatory activity. It supports the health of the tight junction proteins, which improve barrier integrity, not only in the intestinal tract and the blood-brain barrier, but anywhere there's a tight junction protein. Some drug companies are experimenting with nitric oxide NSAID combinations to decrease the neuroinflammation. So this combination actually crosses the blood-brain barrier and is protective for the epithelial permeability. So repair of damaged cells are essential for survival. The oral microbiome modulates the gut microbiome. We're constantly seeding the intestinal tract every time we swallow or eat or drink. 45% of the bacteria in the oral cavity and large intestine overlap. So I want to caution on the use of mouthwash, antiseptic mouthwash, fluoride toothpaste, which is antimicrobial, and the hydrogen peroxide whitening toothpaste, or anything that affects the microbiome. So nitrite will prevent or reduce bacterial dysbiosis and stimulate eubiosis in our microbiomes. Continued supplementation with nitrates actually increase the nitrate-reducing bacteria on the tongue. They decrease levels of bacteria that are associated with poor oral and systemic health, helps restore local immune and inflammatory responses, and protects the gut microbiome. So the gut-brain immune axis is all positively supported by nitrates. So nitrates are inhibiting the inflammatory process, downregulating oxidative stress, scavenging free radicals, decreasing inflammation, downregulate NOS, which is sometimes seen with IBS. Nitrates are a powerful modulator of the microbiome, supporting colonies of the good bacteria, supports a healthy mucous membrane, which the mucous membrane is our first defense. It helps balance the good bacteria and the harmful bacteria. Nitrates help prevent dysbiosis, prevents leaky gut, leaky brain, modulates immune and oncological pathways, and maintains homeostasis. Healing cannot and will not take place without adequate nitric oxide. So nitric oxide is needed for the stem cells. Stem cells are what heal us. So nitric oxide directs normal bone remodeling, is antimicrobial, vasodilation and angiogenesis, modulates the inflammation, is involved with cell proliferation, differentiation, and apoptosis, increases collagen formation in the fibroblasts. Nitric oxide and nitrite inhibit ischemia reperfusion injuries. 70% of the diabetics develop diabetic peripheral neuropathy within 5 years. You've got impaired blood flow, and nitric oxide acts as a neurotransmitter in some of these autonomic fibers. So the arginine, the NOS pathway is impaired in diabetics. The NOS pathway is pH dependent. In diabetes, you have decreased pH to a more acidic state, so you've got impaired NOS. NOS also requires oxygen, but your circulation is impaired, so you've got less oxygen delivered. You see increased ADMA, which inhibits NOS. And you've got rampant oxidative stress in diabetes. Remember I said oxidative stress uncouples NOS, which then increases oxidative stress. In insulin resistance, you see increased NOS uncoupling, loss of endothelial function, increased adhesion molecule formation, your VCAM1, your ICAMs, and increased oxidative stress. The GLUT4 receptor requires adequate nitric oxide in order to translocate and bring glucose into the cells. And the hemoglobin A1C binds tightly with nitric oxide. So as that hemoglobin A1C creeps up, more nitric oxide is not bioavailable to do all these good things that we've been talking about. So in neuropathy, you've got poor circulation. The oxygen, glucose, and nutrients aren't being able to be delivered down on a little microcapillary level. So you've got the nerve ability to make ATP is impaired, decreasing the function, and then this poor circulation to the nerves prevents sending messages to brain correctly. So nitric oxide increases the vasodilation. So you've got better delivery of the oxygen, glucose, and nutrients to the cell. And just as important, you're clearing away the cellular debris. So nitric oxide improves the nerve membrane permeability to the potassium ions, which improves the function. Nitric oxide helps with pain. Nitric oxide is what mediates the analgesic effects of the opioids, both endogenous and exogenous. You're increasing the cyclic GMP. So low levels of nitric oxide directly contribute to neuropathy, and supporting that nitrate to nitrite to nitric oxide pathway increases nitric oxide directly and also helps recouple NOS, increasing nitric oxide and decreasing oxidative stress. Nitric oxide modulates the blood flow to the muscles for contraction, cell respiration, stimulates the production of and the biogenesis of muscle mitochondria. So you're improving mitochondrial efficiency, making it more efficient at using oxygen. You're increasing exercise endurance and you're increasing like the time to exhaustion. So with that microcirculation dilation, you're increasing the delivery of the nutrients, glucose, and oxygen. You're enhancing the clearance of debris, which you have a lot of it if you're exercising. You're decreasing the viscosity of the blood, which aids the flow. Remember I said the myoglobin has nitrite reductase activity. So it can reduce that nitrite that's acting as a nitric oxide donor to nitric oxide on an as-needed basis. Nitric oxide in pain management. So nitric oxide has antiviral, antibacterial properties. It mediates the stress and relaxation responses, which is associated with the co-release of the endogenous cannabinoids. Nitric oxide orchestrates wound healing and injury repair. It modulates across communication for healing. Nitric oxide downregulates neuronal transmission by inhibiting calcium influx and activating potassium channels. So this causes a hyperpolarization, which prevents these action potentials. And this is precisely how the pain pathways are directly blocked by morphine via nitric oxide. So nitric oxide in studies has shown positive effects in pain management by helping to prevent physical dependence and sedation and allow for a lower dose of morphine. This is an awesome paper. Mechanisms of the protective effects of nitrate and nitrite in cardiovascular and metabolic diseases. The nitrates are reduced to nitrite. This nitrite can go on to increase nitric oxide itself. The nitrite will decrease peroxynitrite production. Peroxynitrite is when nitric oxide combines with superoxide, and it decreases reactive oxygen species. So this peroxynitrite, in a lot of the studies, show that it is the molecule that may, quote unquote, be doing the cellular damage. However, when you're making a lot of superoxide, you're not making a lot of nitric oxide because superoxide shuts down the nitric oxide production. So by supporting the nitrate to nitrite to nitric oxide pathway, you are inhibiting the three main sources of superoxide and inhibiting peroxynitrite formation. So that uncoupled NOS enzyme, remember, it only generates superoxide, not nitric oxide. So you're not producing the peroxynitrite. So nitrates help recouple NOS by increasing production of BH4. Nitrites and nitric oxide inhibit that NADPH oxidase or the NOx enzyme. So you're decreasing superoxide and thus peroxynitrite. And then the uncoupled mitochondrial electron transport chain. Nitrites and nitric oxide help recouple that electron transport chain, prevents electron leakage, decreasing superoxide, and thus decreasing peroxynitrite. So restoring nitric oxide production will decrease superoxide production, and thus peroxynitrite production, decreasing oxidative stress. So when you see in all these studies that they are blaming peroxynitrite for the damage, it's just not true. They cannot even measure peroxynitrite. They are measuring nitrotyrosine, and there's other nitrosating species that can nitrosate tyrosine. It's not peroxynitrite. So when you see these studies, you will see they say may, can be, possibility, all these words, but they're just assuming. So this is a beautiful slide. This shows nitric oxide touching every single physiological process, and from cardiovascular system, neurological system, excretory system, vision, endocrine, immune, respiratory, urogenital. Nitric oxide, the miracle molecule, and as we age, it decreases. So we've got a perfect storm for low nitric oxide. The age, especially over 40, physical inactivity, the SAD diet, full of inflammatory molecules, devoid of essential cofactors and nutrients, devoid of the nitrate-rich veggies, antibiotics, antidepressants, birth control pills. Pretty much any prescription med that can raise blood sugar and blood pressure, you know it is affecting that NOS enzyme. Antiseptic mouthwash, fluoride, whitening toothpaste, NSAIDs and COX inhibitors, achlorhydria, the PPIs, which you can buy just over the counter. When these PPIs were just first put on the market, I remember they were only supposed to be taken for 6 weeks. Insurance wouldn't pay for more than 6-week therapy because they knew. And now we've got people taking them for years. Glyphosate, it's ubiquitous, it's everywhere. And you've got depletion of your BH4 and NOS uncoupling. Pollution, increasing oxidative stress, increased EMF exposure, our phones, our computers, Wi-Fi. These increase oxidative stress, uncouple the NOS enzyme. And the big one, stress. Stress uncouples your iNOS. That's why when we're stressed, we get sick easier. It uncouples eNOS. That's why when you're stressed, we have more hypertension, strokes, MIs, all these cardiovascular complications. So nitric oxide naturally decreases with age, reducing to about 50% by the time we're 40, and as little as 15% by the time we're 60. So testing a person's ability to make nitric oxide on a regular basis is really a convenient way to increase awareness of its importance and allows you to discuss with them how nitric oxide levels can be easily improved. Supporting the nitrate to nitrite to nitric oxide pathway not only increases nitric oxide directly, it helps recouple that NOS, increasing nitric oxide through that pathway and decreasing oxidative stress and chronic conditions. Thank you, everybody.